You have taught us so much about how a country can take ownership and not be donor dependent. And even though we are listed here as the only donor, we know we are not the only donor. Each and every one of you is a donor because you are giving your time, you are giving your intellect, you are giving your passion to improving the lives of children and saving mothers. And so we hope to be here for the foreseeable future, for sure, partnering with you in this phenomenal process. Thank you very much.
That's the official launch of the Kenya Paediatric Fellowship Phase 2 at the Trademark Hotel, which is a joint venture of the in terms with what is happening there.
Spirit that we task ourselves to, and the fact that we've done 500 specialists in record time, better than South Africa. I think this is something that you would consider even having other programs that you can partner with, and we'll be able to implement them in record time as agreed. Next is the representative of Ministry of Health, and this will be none other than Dr. Karimi, who is representing the Ministry of Health. Welcome, Dr. Chair, Council of Governors, Your Excellency Anne Waiguru, Chair, CoG Health Committee, Your Excellency Muthomi Njuki, Vice President, East and Southern Africa, Mental Health Access Initiative, Gerald Masharia, the CEO of CoG, Mary Mwiti, Senior MOH and county officials, representative of KPA, Dr. Supatunje, representatives from counties and academic institutions, our development partners and our key funder, Elma, Bernadette Moffat, distinguished guests, ladies and gentlemen, good morning. So my name is Dr. Janet Karimi, and I'm representing our CS for Health, Honorable Susan Nakumicha, who unfortunately could not make it today. So I'll read the speech on her behalf. I am delighted and honored to be part of this ceremony that aims to improve access to quality healthcare services for our children. Our children are our future. Every parent looks at their child with a hope for their success and prosperity. In the same way, for our country, our future success and prosperity is pegged on our children. Therefore, we must invest in their survival and create an environment for them to thrive and be able to transform themselves, their families, their communities, this country, and the world. The recently released 2022 Kenya Demographic Health Survey showed that there was a drop in the under 5 mortality rate from a peak of 115 deaths in 2003 to 41 per 1,000 live births in 2022. However, the reduction in newborn mortality rate has been slower, from a peak of 33 deaths per 1,000 live births in 2003 to currently 21 deaths per 1,000 live births in 2022. So newborn deaths actually account for 51% of the deaths among the children under 5. So ladies and gentlemen, with this in mind, the government of Kenya has committed to the attainment of universal health coverage by ensuring that all people have access to the full range of quality health services that they need, where and when they need them, without financial hardship. And as part of this government agenda to achieve UHC, investment in newborn survival and health is key, as reduction in newborn deaths will result in increased life expectancy of Kenyans. Investment in newborn health is key, as health and nutrition in the first 1,000 days determines the neurocognitive, physical, social development in a child, which influences their academic success and ultimately their future productivity, and therefore this impacts on the country's future GDP. So investment in newborns to ensure they survive and thrive is a key pillar in human capital development, and therefore is a priority for the government of Kenya. Additionally, investment in a child's health is also an investment in their health all through their life course. children who are malnourished have been shown to have higher risk factor of developing chronic illnesses in future, for example, diabetes and hypertension. So investing in children ultimately reduces the cost of healthcare for an individual across their life course and therefore reduces the national healthcare expenditure in general. So in its commitment to invest in children, the Ministry of Health recognized that there was a limited pool of trained healthcare workers able to provide specialized pediatric care to newborns and the pediatric population. And most of these specialists, as has been said here before, were predominantly found in the urban centers. So the Kenya Paediatric Fellowship Program was developed in 2019 to address this gap by providing scholarships to enable trained specialist pediatric nurses and pediatric subspecialists to give routine and intensive care to children. So the Kenya Paediatric Fellowship Program is a partnership, as has been said here, between the Ministry of Health, the Council of Governors, the county governments, the Elmer Foundation, who is the main funder, the Clinton Health Access Initiative, and the Kenya Paediatric Association, and select training institutions including Moi University, Nairobi University, the Gertrude's Institute of Children Health and Research, and the Kenyatta National Hospital. So we are happy to see the 148 healthcare workers who have been trained. As was shown before in the slides, we have 60 pediatric critical care nurses, 34 pediatric nurses, and 30 midwives. So the program has also benefited 24 pediatricians, among whom are 9 neonatologists, who will give specialized care to the sick and small newborns so that we can reduce this gap in the newborn mortalities. The program has benefited healthcare workers across all 47 counties who have now gone back to serve in the county facilities. This program has therefore contributed already to the reduction that we have seen in the under 5 mortalities across the country. So it is my hope that as these beneficiaries go back to working in the county hospitals, that they shall be advocates for our children, for our children's health and well-being, that they shall mentor health workers in their facilities and even in the lower level facilities as part of strengthening the primary care networks. We envision that the health workers trained under this fellowship program will not only look at treating children at the facilities, but go to work with the linked primary healthcare facilities and even the communities, to work with the community health promoters so that they can provide education to mothers on safe pregnancy, prevention of childhood illnesses, and promote early care seeking for their children when they are unwell. In this way, these pediatricians and pediatric nurses will not only serve the hospitals, but also serve the